Lisa Fox is a certified child life specialist and team lead of the Great Life team at Child Serve in Johnston, Iowa, which is a long-term care and rehab facility. Lisa has over 28 years of experience as a child life specialist at Mercy Hospital in Des Moines, Iowa, Children's Memorial in Chicago, Illinois, and Children's Hospital in New Orleans, Louisiana. Her child life experience ranges from hematology and oncology, bone marrow transplant, radiology, outpatient GI, cath lab, PICU to general peds, and much more. She is also a facility dog handler to Caribou, a chocolate lab that comes to work with her every day. She and her husband have 2 adult children and live in West Des Moines, Iowa. It's my pleasure to welcome Lisa Fox.
Thank you, Courtney. I'm happy to be here today to talk to everyone about working with siblings of children with brain injuries. And I would be very happy at the end for questions and just to get a conversation going about what all you do and what has worked for you or what hasn't worked, and be happy to just talk about things and what would help all of us. All right. So objectives: to identify developmental views of traumatic brain injury, learn ways to communicate with children, and learn how to involve siblings in the care of the child with the TBI. When working with 2 to 4-year-olds, it's great to use simple words, books, pictures, doctor's kits. Show and tell the children what they're going to kind of see. Show things that's going to help describe what the sibling is going through. If they're going to visit that sibling at the hospital for the first time, let them know what they're going to see and hear, what machines, kind of what everything's doing. The 5 to 7-year-olds, keep descriptions simple, use playtime, use toys. This is a good age to let the child collect things, make keepsakes, draw pictures for the sibling. The 6 to 8-year-old crew, use words that they can understand, keep it simple, but be honest. Encourage your child in this age group also to make pictures, take pictures of them and their sibling to when they go visit them. And the 9 to 11-year-olds, be honest and truthful, but only tell them what they need to know. You don't want to get into a lot of descriptions when you're talking and answering questions. Oh, and I didn't finish that about the sibling. So this age group, the preteen and teen, they understand a lot more than we give them credit for. So you want to be honest, but just give them little bits of information, because too much information, they could go down the hole of using the internet. So keep it simple. And at the time of the accident, during the hospital or rehab stay, you want to explain exactly what happened to the sibling, but in a language that they can understand. Your brother or sister was in an accident. They were hurt and taken to the hospital so the doctors could help them out. Oftentimes it's upsetting for the siblings to see their brother, sister, or a parent, whoever that was in the hospital, but it may help them to go to the hospital or drive by it if they're not ready to be seen yet, just to know where they are so they know they're safe. When children ask where their sibling will live, answer them directly. If you don't know, tell them you haven't decided or you're not sure where they're going to go yet. Tell them that it's still too soon if it's a severe head injury, but let them know that the doctors are doing all that they can. And when you know, you will tell them. And then continually let them know that their sibling is in good care and that the hospital staff is taking good care of them. Oh, sorry. This is a lot of words. You guys can read that. But when you're explaining to kids about their sibling being in the hospital, you wanna, when you're using words like coma or traumatic brain injury, that can be very frightening and traumatizing to younger kids or really any age kids. So you want to explain them on their terms. Like a coma is when your brain has been hurt and you're sleeping. Um, you can compare it to something as simple as twisting an ankle. It swells up, it bruises, it turns black and blue, and it needs time to rest. When you're talking about, you can compare that to a coma or a brain injury, that the brain swells and our brains can bleed on the inside and it needs time to rest, and people sleep during this time. Um, you just want to keep it simple when explaining coma and traumatic brain injury to younger kids, so they don't get really scared. There's a lot of information, as we all know, out on the internet, or if they're talking to other friends, people have all these grandiose ideas or things about comas and traumatic brain injuries. So keep it simple, but tell them the truth. Um, you can also keep talking about how people wake up very slowly from comas or brain injuries, that it could take days, even weeks. Um, you can talk about what the brain helps you do, think, move, and feel. And when that brain is hurt, that you need a lot of extra care from this also goes into head injuries, that this can cause, we all know that there's a lot more trauma to head injuries. And so when they may see a sibling post that, they may not act like the way they did prior to the injury. So just continue telling them that when the brain is injured, it takes a really long time to heal. And sometimes people have the injury the rest of their lives, but that there are a lot of places that can help their sibling get better and help with their difficulties. You always want to allow the sibling opportunities to ask questions. Some need to talk and some need to write, some need to draw pictures. Art is really a good way to communicate with kids. And some will ask you the same questions over and over again, and that's their way of coping. So the more opportunities the kids have to express their feelings, fears, and ask questions, the better. You definitely want that open line of communication with them. Some parents try to protect their kids by isolating them or not talking to them or not answering questions. And that's not helping them get through this. Um, Children fear that what they don't know and are wonderfully resilient to the things they can understand at their level. Schools are a great place to get them support if they have it. It's always good to let the school know what's going on in your family. Um, they've got some great services. There's also professional counseling if you think that would help kids in a situation like this, to reach out and let them do some of their own talking. Sometimes kids like to protect the parents and don't always want to talk to you, a mom, a dad, an aunt, and uncle. So it's okay to reach out and get them some extra help. Um, Once a child is able to see their brother or sister with who have experienced a TBI, it's really easy to notice some of the changes. So keeping in mind those developmental views I talked about, here are some of the common changes. There's self-care. It may be good for a sibling to take time for themselves, keep them in those sports, their hobbies, or maybe good to teach them some relaxation skills. Again, I talked about the professional support. It's a lot, as we all know, who have worked with kids with TBIs. Um, it's a lot different from the way they used to be, and it can be a lot of work. So, um, a lot of the attention goes towards that child with the TBI. So sometimes the siblings can be left um, to maybe do more things on their own, or they can feel like they're not as important. So it's really good that we can make sure those siblings are being taken care of. Maybe not only the professional support, but maybe make a special night out with them, a couple times a month, or maybe let them do some extra things with their friends, or if there's grandparents involved or aunts and uncles, make sure they're getting some extra time with people that they love, to know that they're still as important. And celebrate progress. Acknowledge and celebrate the small victories and the progress made by the sibling with TBI, no matter how small or big it is. This reinforces a positive outlook, not only for the child with the TBI, but also the siblings. They may realize that every small step that child, their brother or sister is making is a big deal. No, like I said, no matter how small it is. So we want to make sure that we're including them also in the progress the child's making. Like I said, like they said, work at Child Serve here in Des Moines. I don't know how many of you are familiar with that, but we're um, an inpatient and an outpatient rehab facility. And I'm on the inpatient side, and we have a lot of rehab kids that come through, and we get them on the inpatient side right after, whether it was a traumatic injury or a big surgery. And so we're with them every step of the way. And I have worked with quite a few siblings along the way. And it's really important for them to be involved. In a lot of my time with siblings, working with siblings, they want to be a part of it. It's hard for them to go back to school, or if it's hard for them to go back home and leave here, because they may be involved in a OT or a PT session or a speech session, or they may hang out with Caribou and myself and their brother or sister, and they think it looks like a lot of fun. What they don't see is the hard work they're having to do here. So it's really important to include those siblings as much as you can. Be flexible. I know that's hard for a lot of us, probably most of us, especially when you are trying to support either the parent, you are the parent. Your day is constantly changing, your weeks are changing. Be flexible, adjust to the changes, adjust to everybody, not only the child with the TBI, but the siblings. And I love the word, the new normal. I use that a lot in talking to families, that this is your new normal and you're going to find your new routine. And also, you model resilience. Show your child how you can cope with these challenges and adapt to changes. It's not easy. No one ever says it's easy, but if your attitude can change and show how you guys can do this, whether it's as a family, as a teacher, as someone that's working with this family out in the community, whether it's therapy, school, whatever, if we can model for the family that they can do this, um, then that just shows them that it can be done. And they see us working with families, over and over again, and realizing that, yeah, this is hard work, but you guys can do this. So the positive attitude starts, I think, back in the hospital when they're first there, dealing with the initial reaction of whether it's an injury, post-surgery, whatever it might be. But if we can show families that they can be resilient and learn to cope with the changes, then it's very helpful to be able to do that. And by providing support and maintaining open lines of communication, they can help their child adjust to the changes brought on by TBI in a positive way. So when I was doing some research for this presentation, I thought this was a really interesting statement by a former Surgeon General, that no prescription is as valuable as education. Naturally, education about the nature and consequences of brain injury better prepares the entire family for dealing with brain injury. And some suggestions from other families with long-term experience in managing life after brain injury includes being honest. No one knows the extent of recovery, particularly in the early weeks or months following brain injury, but keep your options open and hope alive. Things have a way of working out, and there are many wonderful and inspirational stories about triumph over disability over long periods of time. This is a picture of one of the patients that I have permission to share, who came in after a very big surgery on her brain, and she wasn't able to walk or barely even talk, and she bonded with Caribou. That's Caribou in the picture. And she worked so hard, and her family was behind her 100%. And they had the most positive attitudes I think I've ever seen working with a family. And she walked out of here, which was really fun to see. So it's just amazing to see what families that we all know can make a huge difference in a child's recovery as well. So other things to give kids, there's a lot of literature and books out there if the siblings are able to read, or there's a lot of coloring books. If they are able to visit the hospital, I'm a big advocate for having siblings visit the hospital, if that's something they can do. When kids can see their sibling, that shuts down a lot of made up things they have in their mind. If that's not possible, then that's okay too. Um, a lot of times, if you do take kids to visit in the hospital, I have always told adults and kids to um, have a safe person. And if it gets way too overwhelming, tell that safe person, whether it be hold up a finger, hold that person can stand in the back of the room. And when you're done visiting your brother or sister, then make that motion to the safe person and tell them you're done. Because it can be really overwhelming to visit someone in the hospital, especially if it's a brother or sister. So when they've had their time, then it's okay to leave, no questions asked. Um, and they don't have to talk about it if they don't want to. It's just they're ready to leave. Um, if they're able to be in the rehab setting as well, that's a little less stressful of a setting than a hospital. Then that's another good one to let them come, and maybe if they're able to participate in an OT, PT, or speech session, if allowed, or just to come visit them in the rehab setting on an evening or a weekend when they're not doing as much therapy, so they can see their sibling and maybe do a fun activity. If they like to write, maybe they want to keep a diary, talk about their feelings or how they miss their sibling, or if they want to draw some pictures or make some things for their sibling. Um, that's a good one. Understand the differences in reaction and validate their differences in feelings. It's okay if one sibling wants to visit and the other doesn't. And it's okay if someone is disinterested. That's their way of coping. No two kids are ever alike and have to do the same thing. And I know that is hard as a parent if they don't want to. And this is a biggie, try to minimize the disruption in the home that has a negative effect on the other children. I know that's much easier said than done. Whether you're a one parent, two parent, you know, three parent, whatever household, if there can be some consistency at home for the siblings that are at home, try to keep that as consistent as possible, keep them in their activities, like I talked about earlier. Um, Consistency is going to be key for those siblings, so they think that their entire life isn't turned upside down and they can at least continue, whether it be whatever dance, sports, whatever band, whatever they're doing, so they can continue some of that would be very helpful for them. We know that siblings are very close and play a vital role in each other's lives. And that contributes to emotional, social, and psychological development. Um, so as much as we can help support that once there's a TBI, these are some coping um, things that we can do to help normalize that experience for the siblings. Allow them to feel it's whether it's emotions, shock, sadness, anger, confusion. Let them feel those emotions. If they want to find some information, let them seek out information as long as it's good information. The best would be information to come from an adult in their life. Um, like I talked about earlier, understanding the real diagnosis or exactly what happened will help them get through this. Again, talking about it, share your feelings with them. If you cannot be there with them, then give them an adult that they can share feelings. And it's okay for you to let your feelings show also to your child. Again, let them ask as many questions. If they have questions for a doctor or a nurse or someone in the medical field, have them write them down. We all know it's hard to get to a doctor. So have them write a question down for the doctor or a medical provider and have you ask that. I think the physicians would really appreciate that. Let them be present as much as they can with school and other activities, but also you, the parent, being there for them as much as you can. That's important also. And just encourage to keep the lines of communication open with parents and kids as much as they can. And again, letting them be involved as much as they can and want to with their sibling is really important. And always remind them that the parent is there to listen to them whenever they need it. When it's time for the child with the TBI to go home and back to school, um, that's a big deal. They're most of the time they're still working on their rehab and they switch from inpatient rehab to outpatient rehab and they're still recovering. There's still going to be challenges. So it's good to prepare your other siblings, the siblings of the child, that there's still a lot of work to be done and their sibling is not completely healed. So it's good to let them know what the child is still working on. Um, Use words like better rather than cured, recovered, um, and that let them know what they're still working on. Um, you can let them know that everyone is still trying to do better, get better. You never want to give false hope that, oh, Joey is all better and back to normal if that isn't the case. There's that fine line right there. The siblings are usually the first ones to recognize that their sibling is not the same as before. Even little personality and cognitive changes, they recognize, but they're also the most accepting of those changes and they want to know how they can help. Younger brothers and sisters with an older sibling with TBI may um, find themselves as the older child in the family with new roles and responsibilities. Um, any way you can support them, help them to make your family whole again is important. But again, once everybody gets home with the child with the TBI, it may be a good idea to sit down and See how everybody's doing, do a little family check-in, see how people want to be supported, and enjoy being back as a family again. And we all know siblings will be the best support once the sibling goes back to school, because there are going to be differences, especially high school years. It can be hard for an adolescent with a TBI. Um, Siblings are going to be the ones who understand that their loved ones' needs have changed. Um, so they're going to be the ones that stand up for him, go to bat for him or her. So these guidelines will hopefully help siblings better understand what life for their brother and sister may change. Their own lives will change as well. The more siblings are given opportunities to learn about traumatic brain injury, express their needs and feelings, they will be better equipped to deal with the sibling and all the changes happening around them. So questions, comments, conversations. I'd love to hear what other people's roles are.
I don't see any comments or questions in the chat box. Just pause for a moment and give folks time if they have anything they'd like to share or ask. Well, I'd like to take this opportunity just to say thank you for sharing your just in rereading your bio, just your wealth of experience and knowledge. And this has been a webinar that I've wanted to have somebody put together and do for us for some time now. This is a topic that we don't hear about enough, but it's always timely and it's so needed. So thank you so much, Lisa, for your
Sure.
time today and for sharing this important information with all of us.